In this edition of For Your Health with me, Kate Delaney, I hope you sit up and pay attention, and here's why. Irregular heart rhythm is a major risk for a stroke. Did you hear me? Here's another shocker. AFib is killing people. What is AFib? A quivering or irregular heartbeat. What are the dangers? Oh, boy, especially if it goes undetected. I am so pleased to welcome to the show Dr. Ron Passman. He's the director of the Center for AFib at Northwestern Medical Hospital in Chicago. Doc, thanks so much for joining us.
Thanks for having me.
So let's talk about AFib. People hear that, and I sort of explained it, but I'm no doctor at the top. Tell us what AFib is and why we keep hearing that.
So you keep hearing about it because atrial fibrillation is the most common abnormal rhythm of the heart in adults. So it's estimated that if you're, let's say, in your 40s and you're lucky enough to live to your 80s, that you have about a 1 in 4 chance of developing AFib in your lifetime. So this is a disease that will affect, many of us or our loved ones, and it is a major cause of stroke, as you mentioned. People with AFib have about a 500% increased risk of stroke compared to patients without atrial fibrillation. And that's why finding AFib and treating it is really a public health concern.
Yeah, scary just even hearing that number. So what are the risk factors with AFib?
So the number one risk factor is age. This is generally a disease of getting older, and we see AFib a lot more in 70-year-olds than we do in 30-year-olds. But there are additional risk factors, things like diabetes or hypertension or congestive heart failure are all risk factors for the development of atrial fibrillation.
Wow. So age, obviously, some of what you just mentioned, and I'm thinking milestones and major events from research, because let's hear some good stuff. What have we uncovered?
Oh, there's a lot that's gone on. I mean, this is one of the most intensively researched areas in cardiology because this is such a common problem, and this really has so many manifestations. So I would say that some of the big milestones have to do with stroke prevention. We've known since the 1940s that a drug called Coumadin or warfarin was effective at preventing strokes, but anyone who's been on that drug knows that it's hard to take, that you need to have your blood levels monitored, and that it interferes with foods and other medications. So over the last 8 years or so, we now have 4 new medications on the market. You've probably seen commercials, and these drugs are probably better, safer, and easier to take than warfarin. So that's one big issue. I think the other big development is the area of ablation, right? It used to be that if you had atrial fibrillation, there wasn't much that we can do. There were medications that were developed to hopefully keep you in a normal rhythm, but those medications have limited efficacy and some serious side effects. So over the last 20 years or so, the concept of ablation, where we go into the heart, find out where the AFib is coming from, and eliminate the source of the atrial fibrillation, has really developed as a very viable option for patients who have symptoms from AFib. And that last issue, I think, is another development that we're witnessing still today. I mentioned that AFib is very common, but what I didn't tell you is that while many patients may have symptoms, and those symptoms may consist of palpitations or shortness of breath or dizziness, many patients are completely asymptomatic. And what complicates the issue even further is that while some patients have AFib all the time, often AFib comes and goes. So you have a disease that may be without symptoms, and you have a disease that may be very intermittent. So even if you went to your doctor for a routine exam, and your doctor examined you and said everything is fine, that doesn't mean that you don't have atrial fibrillation. So we're living at a time, though, where we now have consumer-grade electronics, things that you can download to your smartphone or attach to your smartphone, or that come built into smart watches that now allow us to constantly assess someone for atrial fibrillation. So every day now, I have people coming to me because their Apple Watch told them they had AFib, not their doctor, right? Not their symptoms, but their watch told them for the first time.
Yeah, which is incredible. It's funny you mentioned that because I just got an Apple Watch, Doc, a couple of weeks ago, and that's the first thing everybody said to me. Didn't your grandfather have heart problems? You're healthy, but you never know. And that's one of the first things I did. And I think it's incredible that your smartwatch can help you know what's going on with possible AFib symptoms, etc. and you can then go to your doctor, and that leads to that. So pretty amazing. And in this edition of For Your Health, we're speaking with Dr. Ron Passman, director of the Center for AFib at Northwestern Memorial Hospital, and we're talking about smartwatches and how you can determine that maybe something's wrong with you there. Are there any downsides though to the technology?
Well, I think the two downsides are, with any screening tool, you run the risk of false positives, right? That the watch picked up something that isn't atrial fibrillation. But listen, no doctor is going to treat you based on, the smartwatch alone. You can record an EKG from the watch, and therefore, we will confirm the diagnosis. So that could create some anxiety until that diagnosis is straightened out. But I think that these watches are quite accurate. And then I think the other downside is that these things are still costly and maybe out of reach of many people who might benefit most. So my hope is, that as this technology trickles down, that it becomes more affordable, and maybe one day this is something that an insurance company would pay for, because maybe it's cheaper to find the disease and intervene before that catastrophic event happens, which is not only catastrophic to the individual, but much more expensive to the healthcare system as well.
Yeah, what about, because I know as people are listening to this, and this is the first thing I thought of, what are the lifestyle changes that can impact, AFib? I'm thinking diet, and then there's others as well.
Right. So some of them, we can't control, right? I mean, this is a disease of getting older, and we can't control that process. But there's a lot that you can do. We know that moderate levels of exercise are good at preventing atrial fibrillation, that a sedentary lifestyle, but also, actually, interestingly, endurance athletes may be at higher risk of developing AFib. So there's sort of a sweet spot for moderate levels of activity. We know that minimizing alcohol intake or eliminating it altogether is important, that people who drink anything really more than a glass of wine or a glass of beer with dinner, harder liquors and more than that seems to increase your risk. Obesity is a risk factor that we can modify, and a very important one is getting evaluated for sleep apnea, because people with sleep apnea are at much higher risk of developing AFib, and if your sleep apnea is not treated, the ability to control the atrial fibrillation is also going to be limited. So I think those are the big ones, is, diet and exercise, minimizing alcohol intake, getting your sleep apnea evaluated. And then interestingly, there's data too on minimizing the stress in your workplace, and getting a good night's sleep are also important in the long-term prevention of AFib.
All right, I scribbled those all down. I hope everybody was listening. How about somebody with AFib? Because that's the first thing I think of when I attach stroke to it. How can you prevent a stroke?
So, these blood thinners are incredibly effective at preventing stroke. The sad truth is that maybe only 50 to 60% of patients who should be on blood thinners aren't on them. And we don't know whether the doctor's not pressing it enough or people are listening and not accepting it, because let's face it, these blood thinners do have the risk of bleeding, but the risk of bleeding really is minor compared to the risk of stroke and the efficacy of these drugs. These new drugs that are out have a much lower risk of serious life-threatening bleeds, and there are antidotes to all of these new blood thinners. So I would hope that your listeners, if they have been recommended to take a blood thinner, have tried it. The other important thing to know is that there's now a procedure where we could deploy a little umbrella-like device inside the heart, snake through the blood vessels, that can wall off the area where the blood clots form. So there are some people who need to be on a blood thinner but can't take it because of bleeding consequences. And for those patients, this little procedure called a Watchman device may be a very viable alternative. So if you have AFib, I would urge you to speak with your doctor. This is a constantly and quickly evolving area, and things that didn't exist 5 or 10 years ago are now widely available. So this is an ongoing conversation between the doctor and the individual with AFib.
Yeah, I love it. Doc, real quickly, where can people go for more information?
Well, here at Northwestern, you could access our website. It's heart.nm.org, and the phone number at Northwestern is 312-NM-HEART. And I'm also going to give you the website of our professional organization, which is the Heart Rhythm Society, and that website is hrsonline.org.
Great. Dr. Ron Passman, Director of the Center for AFib, Northwestern Memorial Hospital. Thanks so much. This has been invaluable, I'm sure, to so many people listening. We appreciate you joining us on this version of the show.
Thanks for having me.